My name is Nicholas Barasa, as you can see from the screen, and I'll be sharing a presentation on how health financing affects availability of medicines, with a focus on a county government of Bungoma, where I work currently. This part of application for academic purposes, but I'll try and share a few things that will be relevant for us. Just a brief on the introduction. We all understand that there have been various advances in the pharmaceutical industry, which have contributed to transform healthcare. However, especially in developing countries in Africa, about 50% of the population lack medicines they so much need. And there's huge stockouts in public facilities, which definitely leads to unplanned expenditure and also diverting patients to private facilities. There is also concerns about the lack of adequate budget allocations. And studies indicate that in low-income countries where we belong, we allocate about 5% of our GDP to health. Specifically for Kenya, there's been a downward trend in terms of expenditure on medicines in the recent past. And this has been worsened with devolution, where each county appears to do their own things. Looking at the budgets across the country for each county, you'll find that they allocate a lot of resources to the health docket. However, most of these resources go towards recurrent expenditure, that's paying salaries and other operations, and very little is left for medicines. Looking at an example of account of interest, which I'm looking at Bungoma County, in the financial year 2018-2019, they allocated about 40% of their budget to the Department of Health. However, out of that budget allocated to health, 97% was allocated to recurrent expenditure. That left only 3% for development and also including purchase of medicines. Now, as a result of that, most facilities experienced stockouts. And looking at 2017, one of the main hospitals, that's Bungoma County Referral Hospital, was hit by an acute shortage of medicines following cut-off supply from KEMSA, over 21 million deaths. And in 2020, counties generally owed about 2.8 billion to KEMSA, and Bungoma County contributed about 84.9 million in debts. So pre-devolution, KEMSA used to support health facilities where the facilities could order on regular basis, quarterly. However, with the devolution, it's noticed that counties will do their own thing, and like Bungoma County only made 2 orders to KEMSA in the financial year 2018-2019, instead of the 4 orders that they could have made earlier. Looking at the general picture is that there is inadequate funding, which leads to the stockouts, and also there is need that the health budget is increased. The study site was in Bungoma, which I've indicated there are a few things about the county. It has 9 sub-counties, population of about 1.8 million people, 17 health centers, 102 dispensaries, and 52 clinics. The study design adopted was descriptive cross-sectional design, and the target population was the medical superintendents, the health administrators, pharmacists, and procurement personnel at the health facility level. And then at the county, I looked at the county procurement officer, the county pharmacist, and the county chief officer in charge of health and sanitation. I'm not going to this, but each sub-county contributed the 4 officers that I've mentioned. And in addition, we added the three at the county level. That's the chief officer, the county pharmacist, and the procurement, county procurement officer. So our total sample population was 36 plus 3 at the county, making a total of 39. Data was collected using questionnaires to the participants at the hospital level, and then interviews were done at the county level. And an observational checklist was adopted from an essential medicine list that's supposed to be available at the county. And this list was used during the day of collecting data, where I went to the facilities and checked availability of the medicines. Now, on results, this just on demographics, on the participants that I had, a majority were health administrative officers, coming in at 40%. We had 8 pharmacists, that is 25% of all of them. In terms of work experience, most of my participants had 0 to 5 years work experience, and a few towards the end, about 25. When I asked questions on estimated budget allocation, one of the responses indicated that the budget allocation for that financial year was about 2.6 billion. And that one constituted about 20% of the entire county budget. However, it was noted that over 90% of it went towards payment of salaries. And out of now, the amount that was given to health, only 120 million was given for medicines. When you look at this in terms of percentage, it's very low. That's about 4.6%. And if you compare that to what the national government used to allocate those days, you'll find that the county is doing very poorly on what they're allocating for medicines. Then on the budget deficits, most of my respondents noted that they had a budget deficit of between 31 to 40%, meaning they could not be able to finance the medicine needs to the tune of more than 50%. And looking at comparison between inadequate funding as a reason for stock outs and allocating funds for medicines as per the needs from quantification, it was noted that a lot of the participants agreed strongly that it was extremely important to allocate funds for medicines procurement as per quantification requirements. And then it was generally agreed that inadequate funding was a major cause of stockouts. By about, as you can see from here, 43.8 strongly agreed that inadequate funding for medicines was the main reason for stockouts, with only 3% disagreeing to that statement. Then on general concerns relating to healthcare financing and medicines in particular, inadequate allocation of funds for procurement of medicines and lack of rational budgeting were key issues that were faced. And there was need that funds are allocated to medicines as per quantification, and then the health docket to prioritize medicines when it comes to their budgeting. I'll not dwell on that slide, but let me look at this briefly. There was a logistic regression that was done, indicating association between demographic characteristics, the budget allocation, according to quantification needs. And one of the things that were noted is that having a revolving fund was associated with an increased availability of medicines, shown by an odds ratio of 5. Just for a general sake, an odds ratio of more than 1 means there's an association. So in this case, the odds ratio of 5.5 means that there was a strong relationship between having a revolving fund and availability of medicines. Then second item on budget allocation, according to quantification needs, it had an odds ratio of 3.9, which means there's a significant relationship between allocating funds per quantification and availability of medicines. Similarly, training on financial management, training the managers on financial management, there is a relationship that if you train people on financial management, they'll be able to do rational budgeting, and then in the end, you end up with availability of medicines if they do that very well. Then also having decentralization of funds for medicine procurement to the sub-counties. Unfortunately, as much as we're talking of devolution currently, it appears that most of the funds and the decisions are centralized at the county level. So one of the aspects that were analyzed here was decentralizing funds for medicines to the sub-counties. It could increase availability of medicines. Then rational budgeting was not significantly associated with availability of medicines. In conclusion and recommendation is that the study revealed that there was a significant relationship between healthcare funding and availability of medicines. And inadequate healthcare funding was identified as the main determinant for availability of medicines in the health sector. And therefore, when you have stockouts, it means we are not doing adequate funding. Then the county governments need to realign their priorities very well and factor in the health budget allocation and now for adequate resources according to the financial, the global standards. Like there's an Abuja declaration which says that we should allocate about 15% of our GDP to the health sector, something that most counties are not doing. And then it will be important for allocation of medicines to be done in accordance to qualification requirements. Thank you for listening to me. I'll be available for any questions and clarifications. Asante.